Hi, Denise Norez here with AIM Wellness Clinic, and with October being Breast Cancer Awareness Month, I wanted to talk to you a little bit about breast cancer screening. Did you know that 1 in 8 women are diagnosed with breast cancer every year? That's a lot of women. So it's really important that you are mindful and proactive in taking care of your breast health and making sure that you do whatever you can, because early detection will be key to survival. So one of the first things you can do is every month during your menstrual cycle is do a self-examination, and all you'll do is you'll palpate around the breast, and you'll get and make sure you get under the armpit so you can feel and make sure if you notice any changes, and you can call and make an appointment. It's also crucial that you go and do an annual visit every year with your gynecologist. Okay, a lot of women ask me, what is your take on mammography? Well, honestly, I never had a problem with mammography. In fact, I get mammograms myself. So I was asking Dr. Rebecca Perlow, what does she think about mammography? And she got so excited because there's a new technology called tomography or tomosynthesis, so tomosynthesis mammography. And she said that it's amazing. I think it's 97% accuracy rate. So we're increasing detection and decreasing those false positives, which a lot of people are hesitant and nervous about doing in case they get a false positive. So this new technology is awesome. A lot of people are concerned about the X-ray during doing a mammogram, but really they equate the amount of X-ray done as like flying across the country. So you're not exposed to a ton of X-ray for the benefit of being able to have excuse me, early detection rate. Another thing you can do would be an ultrasound. So if you just really did not want to do a mammogram, then do your self-exams, go to your doctor, and you can also do ultrasounds. And there's new technology developing in that will be out soon if it's not out already, which is very exciting as well. There's some discussion about thermography, and when I've done the research on it and when I spoke to Dr. Perlow about it, there's no scientific data that shows that it can help detect cancer. Everything says that it's really important for breast health, or it can be used in conjunction with a mammogram. So as Dr. Perlow said, save your money, just go do your annual exams and your self-exams. And if you really want to do the thermography, you definitely don't want to do that as a standalone test. So the other things that you can do that are really important just for prevention are to continue to eat really healthy, lots of vegetables, antioxidants, managing your stress, and trying to keep the environment around you as healthy as possible. Cancer is one of the leading diseases that we can prevent, and not in every case, of course, but you want to do everything possible so that you don't end up having that diagnosis, and then we definitely want to detect it as early as possible to increase the survival rate. So that being said, make sure you do your exams every month and take action for your breast health and your overall health. Take care.